Okay. All right. So, hi to everyone who's joining us. This is another interview in my Women in Wellness series. These are candid conversations that I'm having with female professionals who have a heart to serve others. And I use this time to talk a little bit about what it is that they do, who they support, and what resources they may have available for you to explore. I'm Britt Reuter, and I've earned a Master's of Science in Human Nutrition from the University of Bridgeport. I am also a certified nutrition specialist candidate, and my approach to supporting clients is informed by functional medicine. I run an online virtual clinic from my home in the Boston area, and if you want to learn more about me and what it is that I do, you can visit my website, brittreuter.com, or you can find me on Facebook or Instagram at nutritionbrit. Today, my guest is Dr. Taylor Meyers. Taylor is a doctor of chiropractic at Core Lifestyle Clinic in Minneapolis. She sees patients of varying ages and activity levels, but finds that most of her patients she attracts are young professional women. She believes in empowering her clients to be strong advocates for their own health and aims to help them understand the physical and emotional causes of their ailments. Thanks so much for being here, Taylor.
Yeah, thanks for having me.
Yeah, absolutely. I'm so excited to get to share you with my little audience here. So thank you again. Let's just dig right into the first question. So why don't you tell us a little bit about who you are and how you decided to become a chiropractor?
Yeah, so I am from a super small town in Canada, and I grew up super active, outdoors all the time. Like, this was before kids had cell phones. We would just get home from school and like run outside till dinner time, and then we'd be back outside again. And I played a ton of sports, and I'm super tall. And so when I was like in 7th grade, my mom was like, all right, you need to go to a chiropractor because your posture is horrendous. And so she took me in, and I was like, oh, that sounds really cool. Didn't really think anything of it. And then kind of as I grew up and was more active in high school sports and everything, I continued to see a chiropractor. And I was like, oh, this is like kind of really cool. Like maybe I would like to do it, get to work with active people, and you're moving around, you're not sitting at a desk, which is pretty much my least favorite thing to do.
Right.
And then actually I was talking to my chiropractor, and he was like, you're going to college soon. What are you going to do? And I said, well, maybe I'll be like a physical education teacher, or like maybe be a chiropractor. I think that would be really cool. And he was like, you should be a teacher. Like, I'm just kind of like taken aback. I'm like, oh my gosh. And he's like, like you get all these amazing benefits, pension, you get summers off, like good pay. You don't have to deal with patients. You have to do notes, all this kind of stuff. Like, he must have been having a bad day. But anyways, so I was like, oh, like maybe I should just rethink this. And anyways, I went on to school and I studied kinesiology at Lakehead University in Thunder Bay, and loved it. And I took a couple education classes while I was there, and I was like, I don't think this is for me. Like, I just am not digging it. And then I like was thinking, and I'm like, I don't even like teenagers. Like, they're the worst. Why do I want to hang out with them all day? And I really like what I'm learning, and I kind of want to apply it to a greater population and help people. And then as I was coming up on graduation, I hurt myself quite badly doing insanity videos in my bedroom. So word to the wise, maybe avoid those videos.
Yeah.
And anyway, I found a chiro down there, and I was seeing him. And I mean, I was like going from not being able to move or sleep for 2 days to being like back to normal in a couple of weeks just because of my chiro. And I was like, hey, this is what I'm going to do. So then I moved down to Minneapolis and started school, and I guess the rest is kind of history from there.
That's awesome. Yeah, we share being very tall, so I definitely understand.
You get it.
Some of the struggles, like everything is so much lower, because it's built for people of a certain height, and so you find yourself always like, bending over things.
Oh yeah. Well, I think I started, I'm like, all my friends are like 4 foot when we're in elementary school, and I'm like, what's going on down there? Like, I want to be on your level.
Yeah, elementary school is tough for tall people.
Totally.
That's a great story. Yeah, thanks for walking us through that. So what does a day in the life of Taylor look like as far as your health routine goes?
Yeah, I mean, there's definitely a difference between what does my typical like 11-hour workday morning routine look like, and what does my optimal morning routine look like. But I think that what they share is that I do try to like create time for both my mental and physical health. That's super important for me. Especially with being, I mean, anybody I'm sure you're interviewing is in kind of like a service-based job where you're dealing with people all day. And it's very important to take time to yourself, especially if you're like me or an introvert and you're just giving all day and you go home and you're like, I don't want to talk to anybody. But I think like in my ideal day, which is typically my Thursdays because I have the morning off and I don't start working until about 3. I do get up without an alarm unless I'm in the summer. I actually do inline marathons.
Wow.
And so I will check the weather, and if it's going to be real hot, I'm going to get up early and get my rollerblade in. But otherwise, I try to sleep in and just give my body the rest that it needs. Then I'll get up, and every morning, regardless, I try to drink a liter of water as soon as I wake up.
Wow.
It just helps me feel better, feel hydrated, makes your skin look better. It's one of those things that I'd read years ago, like hydrate your body first thing when you wake up in the morning. And so that's the first thing I do. I have my big hydro flask and I just chug it down. And then usually I'll have some coffee and just kind of unwind and relax in the morning, and do a little bit of journaling, maybe a little bit of reading, just kind of spend time with myself. Then I'll have breakfast, which is pretty much always the same thing.
What do you have?
I typically have 3 eggs, and then I try to have some greens of some sort. Usually in the summer, it's some greens with berries and some nuts, and sometimes some bacon or some toast, depending on what my activity level is going to be like that day. And then I'll usually get a workout in and kind of just spend some time cooking lunch in the afternoon or meal prepping and just kind of doing errands I need to get done and having some me time, and then I'll go into work. So it's nothing crazy. I don't do a ton of supplements. I usually, in the morning, I am working on my adrenal health. So in the morning, I'm taking an adrenal support. And then at night, I usually do magnesium and CBD. And that's pretty much it for me for supplements. I don't do a lot of protein powder. I kind of use collagen from time to time. I'm not super good about being on a regimen with that.
Yeah.
But yeah, that's pretty much my day right there. And then I go to bed really early. I go to bed anywhere between 9 and 10.
Wow.
Yeah.
On your like longer work days, you said that you work sometimes like 11 hours, just like go, go, go. How do you find that you're able to like sustain your energy, especially as an introvert? Like, what is it that keeps you going during those long days?
The fact that I only have 2 of them is a big one. So my Mondays and Tuesdays are long. So I just kind of power through knowing the rest of the week is going to be smooth sailing.
Right.
But also because I run my own business, I have the ability to take time off in the middle of the day. So I usually work from 7:30 until about 11:30. And then I take a 3-hour lunch break. And so that looks like the first thing I do is I go and I work out, and then I'll typically go home and have some lunch and just kind of relax before I go back to work. And just having that time for myself in the middle of the day, just to kind of recharge, even though a lot of people don't think that working out is recharging. For me, it just kind of is like my time to not have to talk to anybody. Right. It's like forced solitude almost. And so that's energizing for me. And then I just eat lots of food and drink lots of water and just get through it. So also I do have a pretty good relationship with most of my patients. I don't have a lot of patients that I don't get along with or that I don't love treating. So that's helpful. A lot of times I'll have patients walk in and it's very exciting to see them and get caught up on what's going on in their life. And that makes a big difference because there's definitely patients out there that are energy drainers. And those are the ones I try to be like, all right, well, bye. And I don't try to reschedule them.
You got to have those energy boundaries, right?
Yes. I have not fired a patient yet, although I'm sure the day will come. But speaking of energy boundaries, I do actually carry a Apache tier in my pocket.
Oh, cool.
Which is like kind of a negative energy repeller and just kind of absorbs the crappy energy. And then also I have a patient who does a lot of spirit animal work, and she went on a journey for me and told me that my spirit animal is a white dove.
Whoa.
And that I should crawl into the belly of my white dove when I'm treating patients.
So just like kind of visually putting yourself in
yeah,
a place to help
yeah,
create a barrier.
right, totally. So just like no energy will get in. It's like the animal will protect you. And so, I mean, I don't always do it. I kind of forget sometimes, but it's a nice reminder to just be like, even if it's just like that puts you in a different thought process, a different place, to be like, okay, this is separate. This energy is not entering me. Interestingly enough, we're getting into the woo-woo side of me, but whatever. When I actually first started working, I was getting a lot of wrist and elbow pain. And it wasn't like it was my first 4 months in Cairo, so I was just like getting used to it. It wasn't that even. It was like 6 months in, I just started getting like, so like I had just like a bunch of crap in my right forearm. And my massage therapist, a couple of people were like, it's probably just like people's energy is just kind of like getting stuck in you. It's just kind of like clogged up. And I was like, okay, interesting. Interesting. So
that's so cool. Yeah, I feel
yeah.
like it's interesting because obviously like going through a doctorate program or like the master's program that I've been through, it can be very like left brain, analytical, evidence-based. And, you know, I think that once you kind of get out and you start implementing some of these things, you see how similar science is to, you know, spirituality and, you know, energy and all of, you know, these different concepts that we like to label as woo, but it's really all just kind of a spectrum of our human existence.
Totally. I mean, at the basis of everything is energy, right? And like no one can dispute that. And so I think that it's becoming more and more mainstream and a lot less like, oh, what a weirdo, like what a witch.
Yeah.
Whatever. So I embrace it. Like I totally like when I feel like I've established like a decent rapport with my patients, like I totally talk to them about that stuff. And that's where a lot of like the talking to people about how their emotions are affecting their bodies, where that all will start to kind of funnel into the treatment process. But
yeah. 100%.
Not everyone's ready for it.
No, yeah, that's true. That is true.
So people like, I don't care, just fix this if you can, like do whatever, I don't care. Don't talk to me about my dad.
I think that even by being open to just share your experience, you know, I think that even if someone can't really resonate with your story, they're like, I don't know about, you know, carrying this stone around, or I don't know about spiritual animals and stuff. I think that it at least hopefully encourages people just to kind of just believe themselves, you know, that they can experience something that maybe other people aren't going to understand, but that doesn't make their experience like any less legitimate, any less valid. So I feel like that by you giving yourself that authority just to say, this is my experience and this was what helps me, that on some level, you're also opening the door for your patients to express themselves that way too.
Totally. It's like people like totally sense that. Like if you're shut off, they're just going to kind of reciprocate that and shut themselves off, especially when you're physically touching your patients. Like I actually had a patient say yesterday, she's like, you have a really weird job, as I'm like pulling on her arm. Right. And I was like, yeah, you know, like you're right. But I love that you feel comfortable enough with me to tell me these things. Like, that's great. Like, let's keep this rolling. So
Cool. Awesome.
Yeah.
So what would you say is the most common misconception that your patients have about health?
It's super basic. It's just that people think that, hey, I don't have a disease, I'm not taking a medication, I don't have pain, I'm healthy. And that's 100% not the case. Like health is not like black or white. It's totally a spectrum. Like everybody is somewhere along like that disease spectrum, but it's like, what are you doing to keep yourself on the low end, kind of like from tipping over? So people are always like, where did this pain come from? Like it just randomly started. And I'm like, it's been building for a long time. Like it didn't just happen. You have had this issue or this sickness, whatever you want to call it, kind of creeping up for a long time, but now it's just kind of tipped over the edge to where you can't ignore it anymore. So I think that people just thinking that, hey, if I don't have a problem, I'm fine. I don't need to do anything. I don't need to take care of myself. I don't need to change my habits until boom, it's too late. And now I have to start taking care of myself.
Yeah. It's like health seems to be more about optimizing, right? Where it's like, how healthy can we feel? Like how much vitality can we cultivate? Not always just like that symptom-based approach where it's like, you're kind of dealing with the, how little can I get away with? You're like,
Yeah.
how great can I make myself feel?
Totally. I think that's like the main objective of chiropractic, is to like instill vitality in people. But we get this like rap as just pain doctors and last resorts for people before surgery. And we're like, at the end of the day, like, we just want to help you feel as good as you can and function as good as you can. But yeah, that is a big misconception about my job, not to say about health, but yeah.
It's kind of a related question, but what would you say that the technique or food or supplement or whatever, what do you tell your patients most often to stop doing?
A lot of things. But I think there's two big ones. One is just, I don't do a ton of like supplementation recommendations to people unless they ask me. But I tell them to stop taking supplements at random. Like, at the end of the day, you could just have a really expensive poop because you're just like throwing stuff into your body. You're not absorbing it. You have no idea what you're taking. So that's a big one. And then the other one is to stop wearing shoes. Like, that's such like a me thing. Like, I hate shoes. And so people are like, oh, it's just because she hates shoes. But seriously, they're so necessary. People's feet are just like so numb, and they're such an important part of not just like sensation in the body, but activation of musculature. And people just wear them all the time, like in their house. Like, what are you doing? Like, take your shoes off. So I think those are the two biggest ones I tell people to stop doing.
I had recently gone to a podiatrist with ankle pain, and they gave me orthopedic inserts, and they said, wear this 100% of the time, inside your house, like at the gym all the time. And I asked, like, is this going to correct the issue? And they were like, no, like, it's not going to correct the issue. Like, you just have to wear them like every hour of your, waking life for the rest of your life.
They are part of you now.
Yeah. And maybe some people would be satisfied with hearing an answer like that, but I was not.
No. Well, and like, so my biggest thing is like, I'm the anti-orthotic person. But if your body, just the reason why is because if your body is so used to walking a certain way and then you throw a lift on it, it's going to completely affect the mechanics of your entire body, whether it's good or bad. Yeah. But it's going to result in some issue, and it's not, and like they told you, like, it's not actually fixing anything. It's just putting a Band-Aid on it, which you have to wear all the time. So that's why I'm a big, like, get stronger. Let's fix your body. Let's not just throw a Band-Aid on it. You could take ibuprofen for the rest of your life too if you wanted.
Exactly. Yeah. Symptom suppression, like you're saying. Is there like a minimal shoe or like minimal footwear that you prefer or that you use?
I do not have like a brand that I recommend at all. I wear Birkenstocks pretty exclusively. Like, yeah. Just because the main reason is that because there's no scrunching of the toes. Yeah. So you're not compressing toes into toe boxes. And so there's like less chance of bunion formation and all those things. But anything that's a 0-drop shoe, so like a Converse that's not lifting your heel up or anything like that, is really important. I'm not necessarily telling you to go buy a pair of Converse, but that idea, because when you have a heel lift and it actually shortens the Achilles tendon, which then shortens calf musculature, the hamstring, and kind of all the way up the chain. And that's why there's such a greater occurrence of Achilles tendon ruptures these days in young people who are healthy, because they spend all these time in shoes that are heels, especially in women. And then when they get into their training shoe, which is flat or barefoot shoe, there's so much more tension pulling through that calf and through that tendon that it just can't keep up with the force.
Yeah, in researching my like feet and ankle issues, it's very like mind blowing in a way, like how everything's so connected. In a certain sense, it shouldn't have been that surprising to me, being in functional medicine, saying all the time how everything is connected. But I was always thinking of that in a much more, internal way, like, what you eat affects your body in these ways. But really, like what you put on your feet matters. Like even, learning about how it changes the way that your jaw is carried and how that can be part of your balance system. It's like, I never would have connected anything to do with my footwear or the strength of my ankles or feet muscles or calves, or all the way up with, something that was going on with my face.
Yeah, I know. It's crazy. Like, and I think I made a post about that on Instagram a while ago about like, hey chicks, like stop wearing heels, because it's probably like, especially if you have a tight jaw,
Yes.
because that's could be caused from the instability in your ankles because you're always wearing heels and all of those things. It seems just like this wild like correlation, like, oh my gosh, like how could that ever be? But it's just basic mechanics.
When you think about it, like you really sit with it, it does make sense. It does seem intuitive. I think that people just aren't used to hearing it. It sounds so far-fetched when you first are introduced to that concept, which is so great that, that you have such a good rapport with your patients, because then you can say outlandish things like that and they believe you.
Yeah, totally.
Definitely high heels, jaw, got it. Done.
Yeah. Throw them away, burn them.
Yeah.
But yeah,
as tall girls, we don't even need the heels anyway. So
no. Yeah. I think those people are just like, whatever, you're tall, you don't get it. Like, okay, whatever.
Even
probably
like you're
true.
saying though, like a pair of running shoes, with the heel lift on those, they can be, pretty substantial, even like 2 to 3 inches.
Oh yeah, 100%. And then you're running already on your toes and you're already weakening your posterior chain typically. And that's how you end up with running injuries. So, I mean, obviously, like we live in a world where we can't go running barefoot for the most part. But at the same time, like if we grew up wearing shoes less and in more minimal style shoes, then it wouldn't be such a departure to move towards something like that, instead of needing like a 3-inch cushion on the bottom of your running shoes because you have such bad foot pain when you run.
Right. Yeah, it's about awareness and just trying to do a little bit better, and maybe even just better for your own kids.
Totally. Those are the adults that are going to be coming up, right? So
yeah, exactly.
Small changes.
Future chiropractic patients.
Yeah, exactly. I've got like 10 infants in my practice right now, which is super fun.
So sweet. Get them set straight right away.
Exactly.
Awesome. Well, this has just been so much fun. Where can people that are watching this learn more about you and connect with you and the work that you're doing, keep in touch, all that?
Yeah, so on Instagram, my handle is at Dr. Taylor M. And then our website for the clinic is corelifestylemn.com. And that can link you to bio and scheduling and all of those things, and just learning more about our practice and what we do. We're pretty integrative, so we have everything from personal training to massage therapy, PT, sauna, dry needling, chiropractic, a little bit of everything. I think that's really all the social I have.
Yeah.
I feel like I should have like 6 more handles to tell you, but that's it.
Well, just to plug your Instagram, I follow you on Instagram, obviously, and I get a lot out of your posts, like just like visually very aesthetically very pleasing, but then you have some really killer content in there too. I feel like I've learned a lot, just even like how to modify my form during exercises, or maybe helping me to explain, like when I'm feeling this discomfort, what might be the root cause of that. So I highly recommend that people follow your page, because I'm getting so much out of it.
Oh, I'm super excited that you're getting content.
Yeah,
content out of it, because some days it's hard.
Yeah.
It's like, I don't know, what do people want to know?
I know.
So
this is void on social media. There's people on the other end though, like me, that are receiving this information and that are, actually putting it into practice in our daily lives. So
it's good to know. Thank you.
Yes, you're welcome. Keep up the good work. So thank you again. And this has been another Women in Wellness interview. And if anybody, is watching this over video and wants to link to any of these things that we talked about today, you can head to my blog at brittreuter.com, and you'll find the transcript there with all the hyperlinks. Thanks so much.